Good morning. Good morning. Good morning. We are live. I'm Dr. Frita, and today we are having ourselves a live Q&A, a blood pressure and kidney Q&A. I popped up and did a spontaneous live beginning of the weekend, and y'all would be surprised to know how many people have been commenting and messaging me. They're like, "Hey, I didn't know about the live. Hey, I had some questions to ask." So I decided to pop on here this fine, wonderful day and give you a chance to come to the stage and to ask your questions. This will be a call-in show. And so thank you for everyone who has been able to pop up over here. If you actually have a question or a comment about kidney disease or blood pressure, I'm about to drop the link right now so that you can come up to the stage and ask your question. Now, when I do drop the link, it's going to ask you to enable your camera and to enable your microphone. Don't worry. If you still have on your bonnet or a scarf, that's okay. Because as soon as you enable your camera, you can turn that camera off. Okay. And so I'll just have your voice up here on stage. And so right now I'm coming over here to drop it. It'll be in the comments. Okay. It'll be in the comment section. And once you click on that, again, enable both. I guess I can't walk and chew gum. Yeah, enable both and then come on up and just ask your questions. You do not have to prepare ahead of time. I am a board certified kidney and high blood pressure doctor. And so taking care of kidney patients is what I do day in and day out. So ask me your question. Hopefully I'll be able to help you. Do remember that what I give is information. It does not replace the medical advice that your doctor gives you. So I'll be providing evidence-based medical information about kidney disease and high blood pressure. So hopefully that link went out. Well, I don't see it. Oh my goodness. One of these old days. One of these old. Let's see. Let's try this again. Here it comes. It's like it's taking a little bit of a minute there. Okay, there it is. All right, so I just dropped the link and you'll see it under me. And so again, click that link to come up on stage. And once you do, yes, enable your camera. Yes, enable your microphone. But then as soon as you do that, then you can take the camera off. Now I'll tell you the one thing I've been really struggling with, I'll tell you the truth, is trying to pin it. And I call myself doing such a good job. But it looks like I really haven't. Can I pin it that way? Not sure, but the link is definitely there. Okay, y'all, let's talk about kidney disease. And oh yeah, there it is. You can even see it under my picture. Okay, y'all, we're gonna work this thing out. All right. So for those of you who are new to me, I am Dr. Frita Fisher. I'm an MD. I have been quadruple board certified. So I am a board certified kidney and high blood pressure doctor. I am also board certified in internal medicine. I'm board certified in obesity medicine. And after I completed my dual internal medicine and pediatrics residency, I became board certified in pediatrics. And so I love to talk about a lot of medicine. I keep it evidence-based. I do a lot of TV medicine, which I'm very proud of. And right here on the YouTube channel, we have over 1 million subscribers. And I'm super excited and very grateful for that, because what we give you here, evidence-based medicine, I have hundreds and hundreds of videos where I share evidence-based medicine in a way that's easy to understand. And so if you have, medical issues, medical questions, if you're going to go see your doctor, then you can just always pop up, look at one of my videos. It'll give you some information to help you to advocate for yourself, right? It'll help to arm you with knowledge so that you don't just feel, like you're showing up. Now, I have someone here on this stage, and this happens quite a bit. It doesn't have you connected. So let me ask you this. Did you enable the camera and enable the microphone? You have to enable both. Once you do, you can turn off the camera right away. Okay, so I'll just have your voice up here, but you can't get around it. You have to enable the camera. You have to enable the microphone, both of them. So if you do that and come back, Then I'll have you up. All right. Well, listen, let's go ahead and get this thing started. I'm going to invite you to the stage, and we're getting this thing popping with our kidney Q&A. All right. Good morning. Good morning. How you doing?
Good morning. Can you hear me?
I hear you well.
Oh, thank you. This is my first time ever doing this, so be
Yay.
patient. I'm gonna be quickly
All
and
right.
hold everyone up. Thank you for taking my call. I
Absolutely.
I was recently diagnosed with CK3A,
Okay.
and my doctor recommend no table salt. So it's been a challenging, emotional, physical,
Yeah.
mental, and spiritually for me.
Yeah.
But this week, I kind of, accepted and just following the protocols. And I was listening to you the other day, and it really helped me and motivated me
Good.
when you were saying some of the things that you recommend that the specialists should be doing. And I'm scheduled to do my sonogram. I think that's what it is on my kidney coming next month. And I've been drinking my water, trying to drink at least 64 to even more daily, as well as hypertension and diabetes as well. So, what is your recommendation? I mean, I've been cooking majority at home without no sodium. What is your recommendation? And like I said, I know it's not following, I mean, what my doctor said is your information. And I appreciate that. Four is dining out occasionally. Oh, I can't hear.
Can you hear me now?
Yes, ma'am.
Okay, good deal. All right. Well, as far as your, first of all, I want to say sorry that you have to deal with a diagnosis. No one wants to hear that anything is less than perfect, and it is tough, like you said, mentally, spiritually. I will say I'm very proud of you for facing it head on, because the good news is that where you are as far as CKD3A, with a good nephrologist, which it sounds like you have, then there are ways to slow down the progression of the CKD, ways to keep it from getting worse. And in some cases, you can even get some improvement. I know a lot of folks say, oh, once you're diagnosed, there's no turning back. And in a lot of cases, maybe the kidneys won't go back to being perfect, but there are ways to potentially improve kidney function, and certainly to keep it from getting worse. So again, yes, as I expressed, and as I heard you got that what I'm providing is information. It's not going to replace the advice of your nephrologist, but just in general, let's start with talking about what CKD3A is. So there are 5 stages of kidney disease, stages 1 through 5. Stage 1 is the best. Stage 5 is where one is eligible for dialysis or a transplant. Stage 3A is the better side of stage 3. And so when you look at your labs, and for everyone who's listening, including y'all in the replay crew, hey, I see you. For everyone who's listening, if you go to your My Chart or look at your labs, look at your EGFR. Okay, it's near where the sodium, potassium, those labs are. And that EGFR, if it is between 30 and 59, is considered to be CKD stage 3, assuming that you've been there for at least 3 months, with some form of CKD. And CKD3A, if it's between 45 and 59. So you're on the better end of CKD3. You mentioned diabetes, you mentioned high blood pressure. Diabetes is the number 1 cause of kidney disease. High blood pressure is number 2. And so in your case, it's going to be best for you to get a good control, a good management of that diabetes and high blood pressure. Try to keep that hemoglobin A1C down. I recommend for my patients to try to get it less than 6. Heck, if they can get it less than 5.7, I'm thrilled. Also managing blood pressure. And normal blood pressure, again, consult with your doctor to find out what range is acceptable for you. But the official normal blood pressure that is accepted by American Heart Association, American College of Cardiology, is less than 120 for that top number, systolic, and less than 80 for that bottom number. And that number changed, less than a decade ago. It used to be that 130/80 was considered to be good. Now, as far as eating, what your doctor told you about avoiding a lot of table salt is definitely something that will be helpful in managing your blood pressure, and therefore also helping to slow down the progression of kidney disease. So let's talk about table salt. Because listen, I was raised in the South. Anyone raised with Southern cooking, especially Salt is something that you get used to. And like you said, it's really tough because nothing exactly tastes like salt. But let's
Exactly.
talk, yeah, we could talk about,
Yeah,
oh,
I was raised and born and raised in Mississippi, so
oh shoot, you about
uh,
that me. My parents are from South Georgia, so you already know what it is. Yeah.
right.
Here's a good thing. There are some substitutes. No, I'm not going to pretend that it's exact, but here are something that should hopefully give you some comfort. So I'll take my mama. She's one of 16 kids raised in the straight up South of Georgia. And she was at, oh, my mama gets tired of me telling her business. Oh, well, here we are. She said
Okay,
7.
it's helpful. It's helpful. Always
Yeah,
other
I don't
resources
think
is
she
helpful.
buys for real. If so, she'll get me. But she was raised one of 16 kids, raised in the South, and she was diagnosed with high blood pressure, like in her late 30s, early 40s. My mama is thin. She was active, jogging 6 miles every other day. And I say that to say sometimes you're just really genetically predisposed. It really might run in your family, and that puts you at risk. But one of the things we did was that we stopped doing a whole lot of salt. Before, I used to add salt to my McDonald's fries. I'm not even kidding, as a little kid.
Mm.
Salt on tomatoes, salt on watermelon. Okay. It's a part of the culture in a lot of ways, right? And so, that being said, it's oftentimes difficult to, food tastes horrible without it. But here's what happens: if you're able to go without adding a lot of extra salt or eating a lot of salty foods and prepackaged foods, if you can stick to it and be pretty strict for at least 2 weeks, then your body will adjust to the new habit.
And that's what I've been doing. I bought the salt substitute, the Mrs. Dash. I've been
Good.
using that, and I, basically I've been using that. And he adjusted my meds, my hypertension med, and my losartan, and then
Good.
he gave me
Good.
another one, big med. He says to help protect the kidney.
Protect the kidneys. Good. So yeah, so you're going to be kind of miserable in those 2 weeks, quite honestly, if you're someone who really loves salt. But in the long term, your kidneys will be happy, your heart will be happy, your health will be happy. Okay. And just to give you an idea of how much salt is considered to be acceptable or normal. So for table salt, according to the American Heart Association, most adults should be having no more than 1,500 milligrams of salt or sodium a day. That sounds like a lot, right? 1,500 milligrams.
Correct.
It ain't nothing. It's not a lot. And here, let's put this in perspective. If you think about a quarter of a teaspoon of table salt, not even a tablespoon, a quarter of a teaspoon, that's about 590 milligrams of sodium. So if you have just 3/4 of a teaspoon of table salt in one day, you've already exceeded your limit, basically. And so I'll tell you what, I do have some resources for you right here on my channel.
Okay.
I have videos. If you go to my kidney disease playlist after this live Q&A, I have a kidney playlist, and I talk about high sodium foods to avoid if you have high blood pressure. I talk about low sodium foods that can help you with your blood pressure. I talk about ways to lower blood pressure naturally. And again, in sharing that, it doesn't mean stop your medicine. Everything you do, I want you to continue to consult with your doctor, but it just kind of gives you some extra information. And I am very careful to make sure that the information I put out is evidence-based. And so as far as eating at home, I also have a video, 15 foods to help to repair kidney function. No, there's no magic bullet, but eating foods that are leafy green vegetables, onions, ginger, beets, berries, foods that are high in antioxidants are going to help to decrease inflammation in your body, decrease inflammation in your kidneys. And so I would start there, avoiding a lot of ultra processed foods, avoiding a lot of prepackaged foods, even prepackaged processed deli meats, trying to avoid those, and doing what you're doing. And as far as, you mentioned Mrs. Dash, salt substitutes, as long as your doctor says it's okay. I'm also using a lot of garlic, herbs, onions, lemon zest, just kind of figuring out other ways to wake up the flavor in your food. No, it's not the exact same as salt, but I'm telling you, if you can get through at least 2 weeks, for most people, like now, I'll go to a restaurant a lot of times, and foods that everyone else seems okay with, I'll taste it. I'm like, that's salty. You kind of get your body used to it. And for your health, it's certainly worth it. So I certainly wish you the best. Please continue to consult with your doctor, and make sure you give us a follow here, because I'm constantly giving kidney information.
Yeah,
Okay?
I was just left my church service, and I was like invite my kids out to go to breakfast, and I was like, okay, I gotta catch Dr. Frita as
Oh,
well.
yay.
And
Thank
just
you so
see,
much.
what is best to get, you know,
Yeah,
you go out for breakfast. But I know the egg white, I've been hearing you saying that and stuff like that.
that's right. That's right. Okay. All right. Well, thank you so much. I see we got
Thank
somebody
you.
else who's going to call in. I
You have
appreciate
a good
you.
day and blessings to you.
Blessings to you as well. Thank you.
Thank you.
All right. Thank you so much. So I'm about to call our next
Now let me see
call
how I do this.
up here. All right. You take care.
Remove from stage. That's what I hit.
Yes, please. And I can help you. There you go. All right. So I see you right here in the wings. I'm about to call you up. For those of you who are just joining, I am Dr. Frita. This is the Dr. Frita YouTube channel. Very proud to say we have over 1 million subscribers. I'm a board certified kidney doctor. And today we're doing a blood pressure Q&A. We're doing a blood pressure and kidney Q&A. And so I'm about to call you up and please ask your question. Hello, hello. Can you hear me?
I'm not able to hear.
Uh-oh, I hear you. Let's see here. My microphone is on. Okay, I'm going to go over here to the chat. Y'all, please put a 1 in the chat if you can hear me in the chat. Let me make sure I have. Okay. Can you hear me now? Okay, so they can hear me in the chat. So it sounds like my microphone is on. I hear you well. I'll tell you what, I'm going to have you to leave the stage and then come back. Okay. I know you
I'm
can't.
sorry, I can't hear. Maybe I'll try back.
Okay. Okay. All right. So I know you couldn't hear me when you came up to the stage, but if you hear me now, then just sign out and sign back in. Okay. And then we'll see. And again, make sure that you enable both the camera and you enable the microphone, which you clearly did because I was able to hear you well. But yeah, do those things. Let's see here. All right. So again, I am Dr. Frita. This is Dr. Frita Live. We're having a kidney and blood pressure Q&A. And if you would like to come up and ask a question about kidney disease, then please do. All right. It looks like I have someone else who's up here. All right. Okay, good. You went off and you'll come back. All right. So let's keep talking. So we are having ourselves a blood pressure and kidney Q&A this morning. You're welcome to come up and ask questions. Again, I am a board certified kidney doctor. I take care of kidney patients. I'm the medical director of a nonprofit dialysis unit. So I take care of patients with dialysis, both home dialysis. I also take care of patients who are pre-transplant. I take care of patients who are post-transplant, among many other things. Normally when I'm up here for Dr. Frita Live, it's on Mondays at noon Eastern Standard Time. On that show, we talk about the latest trending medical headlines and celebrity health news. And yes, we will be here tomorrow on Monday. Ooh, we got an action-packed show. We'll be talking about some of these food recalls, food fear, things of that nature. We'll talk about the executive order that affects health, specifically the vaccines like the MMR. We'll talk about different misinformation and disinformation when it comes to autism and vaccines. And we'll talk about some celebrity health news like, ooh, a young Nickelodeon All That star passed away at the age of 46 with asthma. So we'll definitely be talking about her. And if you didn't catch us last week, we talked about Perez Hilton. We talk about all kinds of relevant current news. So make sure you check out our other lives and that you join us tomorrow. But today I wanted to give you a chance to just pop up here live. And so anyone, if you look, I'm gonna put it back because y'all, I'm gonna get better at this. I was trying to pin the chat. Pin it, but you can see it. Oh yeah, you can see the comment right here where I have this link. If you press this link, it's going to tell you to activate your camera and your microphone. That is necessary for you to come up. But as soon as you do, just turn that camera off and then you'll be able to come up to the stage. Okay. You'll be able to come up to the stage. All right. So it looks like we have someone else joining us. I hope this is you. If you were able to pop back in, let's see how we're going to do here. I'm going to invite you to the stage. All right. I hear you. Can you hear me?
Yes, can you hear me?
Ah, yay. Hello. Welcome. Good morning.
Good morning. How are you?
Doing well. Thank you. How are you doing?
I'm doing good. I was wondering, what are natural things that you can take outside of blood pressure medicine to control blood pressure?
Okay. So I'm glad you asked that question because high blood pressure is it is a leading cause of heart disease. It's a leading cause of strokes. It's actually, listen, did you know this? It's the number 2 reason that I put patients on dialysis in my dialysis clinic. It's the second leading cause of kidney failure. So high blood pressure is a beast. And yes, we have multiple medications. I was traditionally trained. I do prescribe medications. Medications can work, but of course, there's not a medication out there that doesn't have at least one side effect. And so in answer to your question, there are natural remedies, there are holistic remedies, and I'll share those with you. Here's the thing: for some patients, even in doing, using food as medicine, even in using lifestyle remedies as medicine, some patients still require medications. Like I mentioned, my mom, if you're like genetically predisposed, sometimes you can do all the things right, and sometimes that blood pressure is not perfect. And I tell some of those folks, well, you doing all of these natural holistic remedies might be the difference between you being on 1 or 2 medicines versus 4 or 5. That being said, let me just give you some information on things to try on how to lower your blood pressure naturally. And what I'm giving you again is informational. And I do recommend that you consult with your doctor to make sure, to see if these things are right for you.
Okay.
So one way to lower blood pressure naturally, listen, I'll start with the basics. Slow, deep breathing. If you inhale slowly, like maybe inhale 4 seconds, hold it 5 seconds, exhale 7 seconds. Slow, deep breathing actually activates your parasympathetic nervous system. This causes your heart rate to slow down. It causes blood vessels to dilate, and it can lower the blood pressure. And I mention that because a lot of people who have high blood pressure will get it in times of stress, road rage, a speech coming up, your child getting on your nerves. And sometimes you just take yourself a couple of minutes to regulate and do slow, deep breathing that can cut back on some of those sustained blood pressure spikes. So that's one.
Okay.
Another way to lower blood pressure naturally, low salt, right? It's recommended by the American Heart Association that most people have less than 1,500 milligrams of salt a day. Okay, so really watching your labels and trying to avoid a lot of ultra processed food, a lot of cured meats, things of that nature. So that's another way. Here's one of my favorites: exercise. And that might just sound like a little cliche, but listen, we have scientific evidence. There was this one huge study, this meta-analysis, and it looked at 270 different scientific papers that studied exercise and blood pressure, and they came up with the top exercises for lowering blood pressure. I actually have a video here, top 10 exercises to lower blood pressure. Again, it's scientific. And the number 1 exercise, actually, it surprised me. It might surprise you. So yes, running and HIIT training and hiking, all of those things, yes, definitely can lower blood pressure. But the exercises that were most effective in lowering blood pressure.
Walking.
No, that's on there though. That's high
Okay.
on there. Okay, definitely walking. But listen, isometric exercises, and by that I mean squats, wall sits, planks. That was number 1. And here's the theory behind it. So if you think about, like, just doing a squat anywhere from 30 seconds to 2 minutes, depending on how conditioned you are. When you're in the squat position, then your muscles are contracting against your blood vessels, right? And then once you stand up, blood rushes into those vessels and kind of forces them to widen, right, and comply. And so in doing these isometric exercises, the theory is that you're teaching your blood vessels to stretch and be more relaxed. Okay. And so, yeah, but check out my video, top 10 exercises to lower blood pressure. That's a good one. And then let's talk about foods. Okay. Food is definitely medicine. We have some anecdotal studies on hibiscus tea, drinking hibiscus tea a couple of times a day. In some studies, it shows that has a comparable effectiveness on taking certain medicines like lisinopril. Okay, now I don't have a huge randomized controlled trial on that. And that's a tricky thing. For a lot of natural remedies, we don't have huge trials. And one reason is that no pharmaceutical company is going to pay millions of dollars for a study on garlic or on beets, right? It just doesn't make financial sense. And so when I practice medicine, again, I do integrative medicine. I've trained, at Georgetown, Meharry, Emory, I got all the training, and I definitely keep everything scientific. But for some of these natural remedies, because I don't have large randomized controlled trials, I'll look at different case studies, smaller studies. And my number one mission is, as long as I know that what I'm sharing won't harm, and some people, might help, won't harm, when I don't have all the hard data, such as with hibiscus tea. So again, consult with your doctor, but that is one natural way that has been shown in at least some smaller studies, and anecdotal studies, to lower blood pressure. Here's another one. Beets, like literally beets. And so beets have nitrates, which your body converts to nitric oxide. Nitric oxide causes your blood vessels to dilate, and it causes your blood pressure to lower. Okay. So eating beets, beet juice, and I have my own anecdotal study for this. I don't have a diagnosis of high blood pressure, but I love juicing. Look, and if y'all go to my one-stop shop, drfrita.com. I have a discount code for my favorite juicer. I love juicing. So I was juicing beet juice, a recipe that my cousin Shantae gave me. So it had beets in there, ginger, celery, cucumbers, green apple. And I sat up here like a wild woman and drank, I don't know how much. I might have had 2 liters of beet juice just through the day. I don't recommend that. I don't recommend doing that much. But I went to work, I was seeing patients, and I started feeling lightheaded. And I was like, and so I asked my office manager if she'll check my blood pressure. And I'll be doggone, my blood pressure was low. And so I'm sitting there. I said, I drank all that beet juice and my blood pressure is low. And then I was like, oh, I drank all that beet juice and my blood pressure is low. So so I myself am not a randomized controlled trial. I am a participant of one, but just the science that I shared with you, knowing that, beets won't hurt unless you have a lot of kidney stones. They have oxalates. You got to be careful. That's just another way. So those are a few ways. Any other specific questions? And again, I have tons and tons of information on more ways. One video I recommend that you watch right here on my Dr. Frita channel, The Truth About Kidney Detox. That's one in general. And then for blood pressure, I have a list longer than my arm of videos on how to lower blood pressure naturally, high salt foods to avoid, low sodium foods to have, foods that are good for blood pressure. Oh gosh, I did one video just a few months ago where I was going through and trying natural high blood pressure hacks, including sticking my face in ice water. I talk about it and I kind of go through the science and I kind of debunk which ones are up, which ones are down, and which ones are, won't harm you if you take the risk.
Yeah. I have a last question. Thank you for. Do you have to have a referral to be seen at your office?
It depends on your insurance. If you have a PPO, then you shouldn't. But I tell you what, if you go to my website, my office manager door is very, very knowledgeable of all those things. And I also offer a telehealth concierge service here. I'll add that link to the description. If you go to drfrita.com, I have it there as well. But I'm glad you're taking an interest in your blood pressure. And food really is medicine. Lifestyle is medicine. And I'll be honest, as physicians, a lot of MDs don't teach it because we weren't taught it, right? We're taught that you need evidence, randomized clinical trials, which I support. And I believe that. I also, in living and in having a grandmama who raised 16 kids off of all things natural, I know that just because I don't have all of the evidence and the science for some natural remedies, if I can feel comfortable that they won't hurt and will likely help, then I'm able to have those conversations with patients.
Okay. Thank you so much for that. I greatly appreciate it.
You're very welcome. You have a wonderful Sunday, okay? All right. So the lines are still open. I'm Dr. Frita. For those of you who are joining, y'all, please give us a like. por favor, give us a like. We're giving evidence-based medicine, and I'm giving evidence-based medicine here. I'm answering your questions. I didn't have y'all email me or come in early or plan. This is just a nice little spontaneous live that we're having. Again, if you're just joining or if you're in the replay crew, I am Dr. Frita. I'm a board certified nephrologist, meaning I'm a kidney doctor and high blood pressure doctor. To give you a little history on my training, I graduated from Florida State University, FSU, and I've been matriculated at Meharry Medical College, and I was Miss Meharry. I can say that if I want to. I love Meharry. I'm so proud of it. And also, then I graduated from there. I was in AOA. Okay, so I had an A average. I was in Alpha Omega Alpha Honor Medical Society. That's the highest honor attainable by a medical student. Afterwards, I did a dual residency in internal medicine and pediatrics at Georgetown University Hospital Medicine. Once I completed that residency, I earned my board certification in pediatrics and my board certification in internal medicine. And then I completed my nephrology or my kidney fellowship at Emory. And after I completed that, earned my nephrology board certification. And after that, because y'all, I'm just nosy when it comes to medicine, I like to learn, I also went on to earn my board certification in obesity medicine. And so here we're having ourselves a little blood pressure and kidney Q&A. And so now I'm going to invite the next person to the stage. Hello, how are you doing? Can you hear me?
Yes.
Hi, good morning.
Good morning. Good morning. Yes. I have my left kidney removed,
Okay.
and I'm stage 3B.
Okay. All right.
I need to know what I can do to keep my health going with this one kidney. I mean, I'm going to the restroom fine and everything. I just need to know what more can I do. I'm in my late 70s, so that
Okay.
that's my question.
All right, good deal. Well, thank you for coming up. And again, what I share with you is going to be general information. It does not replace the advice of your physician. So we'll start here. Make sure you have a nephrologist. Yes, I want you
do.
to have it. Good. So make sure you have the nephrologist. And you have the one kidney. The good news is that you only need one kidney to survive and survive well. And we don't have to get into why your other kidney is gone. But a little known fact is that a lot of people think that if you have one kidney, you have half the kidney function. That's not so. The reason that we allow people to donate their kidneys is because if you donate a kidney, you're not stuck with just half the kidney function. That one kidney bulks up and does the work of two. Okay. So in your case, you have the one kidney, and now you described CKD3B. There's 5 stages of kidney disease. 1 is the best, and 5 is where one is eligible for dialysis or transplant. For CKD3B, and for everyone who's listening and everyone in the replay crew, if you take a look at your My chart, that EGFR, CKD3B will be an EGFR between 30 and 44. Okay. And so that just means that you're on the lower end of stage 3, but you're not in stage 4. And so the goal will be to keep you there, or even see if you can get a few more points. And so here's some ways, just in general, what I share with my patients on how to move when you have stage 3B. One, you want to make sure that you've had an ultrasound of the kidney, and your nephrologist will tell you when it's time. They would have likely gotten a screening one. If not, I would ask them for one. And just to make sure there's nothing like a blockage or a backup of urine, hydronephrosis, no stones, nothing going on with the anatomy that's causing you to have kidney failure. That's not quite as high as you want. The other thing is managing those top 2 causes of kidney failure. Number 1, diabetes. Number 2, high blood pressure. If you don't have them,
I have both.
You do have them. Okay, so those are risks. So definitely consult with your doctor on making sure that your diabetes is under good management. And just for everyone listening, we don't just look at those blood sugars or the glucose. If you look at the blood sugar that you get on your blood work, that's just a flash in time. It's the hemoglobin A1C, because the hemoglobin A1C lets us know what those kidneys have been averaging over the last 3 months. And so if your hemoglobin A1C is and this is for general for everyone listening, if it's less than 5.7, great. That means you're not even pre-diabetic. Okay. So you want to keep that hemoglobin A1C as low as you're able to. If the hemoglobin A1C is between 5.7 and 6.4, where you're in the pre-diabetes range, I know you shared that you have a diagnosis, and if it's 6.45 or higher, you're in the diabetic range. So the point is, even with the diagnosis, you want to consult with your doctor on keeping that hemoglobin A1C at a lower level, because then you know you don't have all that sugar being toxic to your kidney.
Okay.
Everything, high blood pressure. Now, I mentioned that normal high blood pressure is less than 120/80. However, your doctor might have a different range for you. You mentioned your age. I know for me, for my patients who are growner, especially if I think they might have a more of a risk of falling than a 20-year-old, I might not be that strict with their blood pressure goal. I might have it be a little bit higher. Talk to your doctor about the right pressure goal for you. The other thing I tell my patients, avoid taking medicines that are going to make your kidneys worse. And it's little known fact that certain pain medicines, such as the NSAIDs, non-steroidal anti-inflammatory drugs, and I'm talking ibuprofen, Motrin, Celebrex, meloxicam, Aleve, all of the medicines that work so well for inflammation and arthritis, if you already have CKD, then they can make it worse. And so talk with your kidney doctor about if you need to cancel those medicines altogether or just limit. It's going to depend. And here's a very important one: hydration. Water drinking. Talk to your doctor about the proper amount of water for you. For most of my patients, if they drink 2 to 3 liters of water, they're okay. It varies, so you want to consult with your doctor. But if you think about a 16-ounce bottle of water, drinking 4 of these is the same as 8 glasses of water. So I tell most of my patients to drink anywhere from 4 to 6 of these. That being said, if they have a reason for fluid restriction, they might have to drink less, like if they have congestive heart failure or if they have chronic lung disease. So bottom line, keep working with your nephrologist, talk about the proper diet, exercise, managing diabetes, managing blood pressure, staying hydrated, having limited salt. And there are also certain medications, if you qualify for them, that can help to slow down the progression. So ask about medicines that might be able to help you to slow down the progression of kidney disease. Okay.
Okay. Everything you said, the doctor, y'all must be on the same page, went to the same school, because he's saying the same thing.
Perfect. Isn't confirmation a wonderful thing?
Yes.
So that's what, when I get up here, I make sure, and that's how you do. You try to keep things standardized. I know that if I can come up here and tell you that I'm giving you evidence-based medical information, if I step out and do a little nuance or things that aren't proven, I share that. But everything I share with you is standard of care. And so now you got confirmation. Your nephrologist and I are on the same page. Okay. So I see that you do really, really well. Okay. Make sure you give this video a like and go through and share it with some of the
I'm one of your members.
Oh, yeah. Wait. See, I don't have my voice.
I know it. The color.
Dakala, you know I can keep you in my prayers. Hi, Dakala. How are you doing? All right.
Doing
Tomorrow, so today we're just talking kidney, but you know, tomorrow we're talking about all the latest trending medical headlines.
I got you. I got you.
All right. I'll see you tomorrow, Dakala.
Okay, then. All right. Bye-bye.
All right. Bye-bye. You have a good one.
Yeah.
Awesome. All right. So I got someone else we're about to call up. And for those of you who are just joining, I am Dr. Frita. This is just a second. We're doing a live Q&A, a blood pressure and kidney Q&A. I'm a board certified kidney and high blood pressure doctor, and I'm taking questions live. So I'm going to call our next guest to the stage. Hello, hello. How are you doing? Uh-oh. I have you up here. Are you up here? Let me see.
What'd she say? No,
I hear you. I hear you. Can you hear me?
Are you talking to me?
I'm talking to you.
Oh, I didn't even know. I didn't hear you say my name.
Surprise, surprise. Yeah, so everyone can hear you. No one can see you right now.
Okay.
How are you?
I'm doing fine, and you?
Doing well. Doing well.
Now, I have kidney. My question is that my EFGR is 15 now. It's staying stable.
Okay.
And my creatinine is 3.2.
Okay.
And my last appointment, which was last month, the doctor, he's pleased with that, I just seen my diabetic doctor, and my A1C is 5.6. All
Oh,
the
that's
other,
good. Good A1C. Okay.
and all the other numbers are good. Phosphate, potassium, and that other one. They're all in the normal range. But when I asked the doctor, he said I'm in stage 4 kidney failure.
Mhm.
But I said, what can I do? Just, I don't want to go on dialysis. I said, can I drink a lot of water and eat fruits and vegetables? What do I do? He goes, there's nothing you can do. Nothing can help your kidneys because they're damaged. They're damaged from lupus nephritis.
Okay.
So I'm like, do you agree with that? Because when I drink a lot of water, my numbers, my EFGR does seem to fluctuate, but it stands stable. And I'm doing walking, but I don't know what else that I can do to make it better, if it can get better.
Okay. All right. And again, and I'm hearing the information that you share. And thank you for coming up. Thank you for sharing. And of course, what I share with you will be informational. It won't replace the advice that your doctor, who actually knows you, has examined you. But I'll tell you some information based on what you shared. Your
Okay.
EGFR is 15. You have
Uh-huh.
lupus nephritis, and you're trying different things, the walking, exercising. Sometimes you notice your EGFR will go up. And so your question to me is, does it sound like your nephrologist is correct in saying that there's nothing you can do? Now, there's 5 stages of kidney disease, 1 being the best, 5 being at the stage of dialysis. Yes, technically, you are at stage 4 with an EGR of 15, but if you drop 1 point, then you're at stage 5.
See,
Okay.
now I
And
was at 13.
okay.
I, I
So
had went to 13, but then I came back up to 15.
okay. Okay. So here's the truth of the matter. For a patient such as yourself who's already progressed to where you've been at stage 5 before, so you're kind of CKD4, CKD5, and you have a history of lupus nephritis, the chances are, and I'll just say in general, when I see a patient who has lupus nephritis and they're at stage 4, stage 5, especially if they've been there for months, then there is a great chance that you already have a lot of kidney scarring. When I talk about patients who are like in stage 3A or in stage 2, and oh yeah, we can help to get you better, a lot of times those patients might have kidneys that have been inflamed or temporarily damaged, but as long as their kidney cells aren't scarred, then at least we can get some of those kidney cells back. If you've been hanging out in stage 4 and stage 5 and you have lupus nephritis, there's a chance, and you're a nephrologist, your kidney doctor will know best, that you have some permanent scarring. And if that's the case, even if you are able to sometimes pop up to EGFR of 19 or EGFR of 20, there is a great chance that your kidneys have scarred past the point of being able to go back to 3 or 2. I don't know that. The only way to know that would be monitoring you as the way I presume your kidney doctor has monitored you. Just talking about my patients, for my patients with lupus nephritis who were in stage 4, if I've been with them and seeing them for, a year, 2 years, fighting the good fight, and just, we've held on to kidney function as long as we can, they have a lupus flare. And I know that it's kind of gradually gone down, and I've done a kidney biopsy and I see scarring, okay, then I'm able to tell them, okay, we did a biopsy, your kidneys are very largely scarred. And I tell them, once we get to stage 5, there's not a whole lot we can do at that stage, short of a kidney transplant. Okay. But then I have other patients who will pop down to stage 5, like especially if they have sepsis or COVID or something like that. And in those cases, sometimes it's just a lot of cells that are inflamed. But if I do a biopsy and I see that they're not scarred, well, then they can go up. I say that to say that there are nuances. But if you're a doctor, if it's a doctor you trust that's telling you that you're at the point where there's nothing he can do, and I know I don't like that language, but it sounds like he or she might be saying that your kidneys have already been scarred from the lupus. And I would ask that question: why are you saying there's nothing that we can do? Do you believe that my kidney cells are scarred? And if the answer is yes, then you can always get a second opinion. If it's someone that you trust and who's been following you, then the next question is, what are the next steps? So here, for my patients where I'm in a position where I'm trying to figure out whether or not the kidneys are scarred, here's what I tell them to do. All the things that I've already mentioned on this call today, doing the water drinking, anti-inflammatory diet, low salt, all of those things. But by the time they're in stage 4, and I solidly believe that it's chronic kidney disease, then we start moving to the next steps. One, I refer my patients for kidney transplant. Okay. Kidney transplant is really a life-saving procedure. And of course, you can have a living donor to donate a kidney. And there are different organizations. And I'll give a disclosure. I'm a board member for the Atlanta National Kidney Foundation. And so on nkf.org, we have all kinds of tools on how to do the big ask, ASK, which is asking families to donate kidneys. And there are all kinds of creative ways, and you'll be shocked. Sometimes patients get kidneys from total strangers. You never know where people's hearts are. But I would definitely ask about being referred to a transplant center where at very least you get the information. Find out if you're eligible for a transplant. Find out what needs to happen. Transplant centers will need to make sure you're healthy enough, make sure your heart is healthy, that you don't have any active cancer, things of that nature. And then find out from the transplant center, some of their steps and what to do to get living donors, and just try to give them the list. That's what I recommend to my patients. And then if you don't have a living donor, then you would receive a deceased donor. Okay. If someone is unfortunate enough to have like a car accident and they're a healthy person with healthy organs. So that's one thing that I would talk to your doctor about, the transplant. The other thing, and I'm sure your doctor mentioned it, and nobody no doctor feels like talking about it, I believe, and no patient feels like hearing it. But by the time my patients are in stage 4, and certainly when they've dipped to stage 5, quite honestly, I have the conversation about about dialysis. Now, when I say that, I know those words are jarring. While I'm having these conversations about transplant and dialysis, do know I'm still trying to get their kidneys better. I'm still telling them, okay, let's manage this blood pressure. Let's do this. Let's do that. I'm still working the best that I can to slow down the progression. Okay. It's not a matter of just giving up, but based on the science, based on our medical knowledge, we know that if you have a chronic disease like lupus nephritis, and if you have scarring and you're at stage 4, then there is a likelihood, especially if you've dipped to 5, that in order for you to live and live well, some form of kidney replacement therapy or renal replacement therapy will be necessary, be it a transplant or dialysis. Now, for my patients, if they're able to, my number one recommendation is home dialysis, like PD. Has your doctor mentioned that to you?
No, I can't do that because I'm blind.
Okay. Okay.
And nobody.
Yeah, I'm sorry to hear that.
That's
Sorry to hear that. Is it a pretty much total functional blindness, or is it what they call like legally blind, low vision for you?
No, I'm totally blind.
Okay. Okay. Yeah. So you're living with different challenges here. Yeah. So then, but so even if you do the hemodialysis, I would still ask about transplant. All of that being said, I know the words are heavy, like your doctor saying, hey, there's nothing we can do. I would go in, I'll continue to have the conversation, but I would open my mind, if I were you, to ask, hey, what are your recommendations? If they're talking about getting something placed like an AV fistula or an AV graft, has your doctor mentioned that to you?
Yes, he said that I would need to get a graft since my veins are so small.
Mm-hmm.
And he's already preparing me for that.
Mm-hmm. And I'll tell you, what he's saying, based on what you've told me, does sound like standard of care. Okay. It just based on, again, what I'm saying is only based on information I'm hearing from you. I'm not giving you medical advice. But when our patients have progressed to stage 4 and we feel pretty confident that that's where they're going to be, that's their chronic stage, it is standard of care to have that conversation about dialysis. Go ahead to start to prepare them, and also to refer them to kidney transplant centers. If you told me he didn't have that conversation with you and you're at stage 4, then I would say it doesn't sound like he's treating you in a way that's standard of care. So what he's doing is something that we're trained to do. That being said, and this is it's case by case. I have patients who I prepare, get their grafts in or their fistulas in. But just because I do that, I don't automatically put them on dialysis unless they're having other indications where they need it. So in other words, I have some patients who are sitting there and they're prepared for dialysis, as the standard of care, but I'm not treating the number. If their numbers are low, 14 or even single digit, I'll be honest, like a EGFR of 8, if they're still making good urine, if they have good appetites, if they're not having confusion, if they're not having shakes, if they're not having easy bruising, if their potassium is not out of whack. I have patients who their numbers will be in the range of needing dialysis, but if there's no absolute need, then I just follow them very regularly. So I say that to say that he's requesting the graft, but still ask him the question, the AV graft, say, once we put this in, are you going to automatically start me? Are you going to just watch? And if I don't have symptoms, will we wait? Have that conversation. What will make you go ahead and start? Has your doctor told you as soon as we get this in, it's time to start? Are there other reasons that your doctor feels like you need to go ahead and start other than just the number? You don't have to answer, but just ask your doctor that. And yeah. Mm-hmm.
Well, I've been his patient a long time.
Okay.
The big deal of that, but I was 2.2 for like 10 years or more.
Mm-hmm.
And he's just starting to see changes.
Yeah.
But I mean, I really don't know the reason why he's just saying, he didn't say right away I'd be on dialysis. He wants to go ahead and he said if I get worse, he's gonna go ahead and have wants to do the surgery.
Mm-hmm.
Be prepared like 3 weeks when it heals.
Yeah. And
But
so I'll tell you, at least for my patients who sound similar to what you're describing, the reason is that if you've already dipped in stage 5 and you're right there on the border at stage 4 at 15, when I tell my patients, let's go ahead and prepare, it is because it can take 4 weeks, 6 weeks, it depends, 3 weeks for the AV fistula to be ready to use. And what I don't want is to sit and wait and not have prepared my patients with access and have them to have some emergency where they have to go to the ER and strangers are putting a dialysis catheter in their neck. I don't want that. And so it is standard of care to prepare your patient, especially when you've been watching them for a while, so that there could be a more controlled condition. Yeah.
okay.
So based on what you're sharing, and again, I'm just going on the information, it sounds that what your nephrologist is doing is within standard of care. And it sounds like he's addressing things in a similar way, so the way that I address my patients. That being said, and now that you told me he's been following you for a long time, if it feels like there's scarring and the kidneys really are at end stage or approaching stage 5, one, I'm sorry that you're having to go through that, but this is not the end of everything, the end of the road. It's time to have the conversation about transplant.
Right.
Okay. And on ways to have the best quality of life while on dialysis, if indeed it progresses to that stage. But as far as the preparation is something that sounds to be appropriate based on what you're telling me. Again, this is just information I'm giving you based on what you're telling me. And it sounds like similar ways that I treat my patients if they've progressed to that point.
Okay. And in order to get a transplant, you have to be on dialysis, right?
No.
No?
We have something called preemptive transplants, which is what I try to do. That's what I actually prefer. And that's when we have patients who are progressing to stage 4, and it looks like they're heading that way to dialysis. Well, in those cases, especially if they have a living donor, then they're able to get a transplant before ever going on dialysis. I have several patients who've had those preemptive transplants before ever going on dialysis. Now, granted, they would have already started the process while their EGFRs were kind of higher up and in the 20s. But yeah, so in a case where they're functioning well enough to hold off from dialysis, we can do preemptive transplants. Yeah.
And then I had a friend who passed away. He was a doctor.
Oh, sorry.
internal medicine. He said that if I should ever get to that point, I should get a kidney that was clean, had that the person had Hep C. Is
Mhm.
is
What did he say about the Hep C kidney?
He said it's good. It would be okay to get it because it's clean, and I would have a chance to get it faster. You can get a Hep C kidney faster than the people that are on the transplant list.
Okay. So number one, I definitely want you to continue having those conversations because that's going to be a very personal decision. I'll share my experience. Okay.
Mhm.
So back probably, oh shoot, it's been over a decade now when the transplant centers first mastered being able to completely cure or eradicate hepatitis C out of kidneys and they were donating them. I was horrified. And I had a patient and he was like, I am sick of being on dialysis. He was young in his 20s. He said, they offered me a Hep C kidney and I'm taking it. And I was like, wait, I don't want you. He said, I don't want to be on dialysis. I had a fit. To be honest, though, the science is down to such a beautiful science where whoever told you that is not making it up.
Uh-huh.
Have it down so we can literally eradicate the hepatitis C out of the kidneys. Plus, typically, and it depends on your transplant center, afterwards, the patient who gets the kidneys will often be treated for hepatitis B, kind of like a prophylaxis or a preventive. And then those kidneys often work very well. That patient I'm talking about from over a decade ago, he made me so sick. I was like, wait, no. I was new to it and relatively new doctor. He's doing great. Decade
And,
later.
and he
And
doesn't.
he don't have hepatitis C. Never got it. But don't just listen to me. Ask the transplant center to give you numbers. Okay. Say, okay, that sounds good. Please tell me of the percentage of patients who get hepatitis C kidneys who didn't have hepatitis C before, how many of them develop hepatitis C? And you're going to find an extremely low number. Okay.
Okay.
Extremely. I'm not going to say zero, but it's darn close. It's they do a very excellent job. That being said, you're going to have to make the decision for yourself. Is it worth it for it to be speed up the process and for you to get a kidney pretty quickly if you feel comfortable with low chances of hepatitis C, or does it just not sit well with your spirit and would you rather just wait some years? That's a decision that only you and your physicians can make. But you asked the question, and so I will just share with you from the data and also from personal experience. They really do a great job of getting rid of the hepatitis C in the kidney and making sure patients don't get them. Is there a risk? There's always going to be a risk, but get those numbers for yourself and decide what sits well with you.
Okay. Let's see. Years ago, I tried to get when he diagnosed me with stage 4. Then I said, well, I want to go for a kidney transplant. I went
Mm-hmm.
to Cleveland Clinic, and I wasn't what is they? I didn't apply.
Oh,
Didn't I wasn't. They didn't accept me. They said
okay.
I wasn't ready for it.
So if they didn't accept you, either your numbers could have been too good or you could have had something else active going on. So yeah, they do make sure that you're healthy enough and that the kidneys aren't functioning too well where it's not time. But yeah, but I would have that conversation with your doctor. But just based on what you've shared, there's nothing you shared that's a red flag that sounds like your doctor is doing anything egregious, just based on what you've shared. Yeah.
Oh,
In other words, as you can hear, it sounds pretty much like we're on the same page based on the information I've been given. But again, I would go back to your nephrologist and mention those things that I've mentioned, and very likely your kidney doctor has already thought of them, but just for your own understanding. Once I get this graft, are you starting me immediately? What would make starting dialysis an emergency? I like to be re-referred if I haven't been already to the kidney transplant list, that kind of things. In the meanwhile, is there anything I can do to still try to stay off dialysis for as long as I can, even though I understand, that I've got progression? Like I still want to try to stay off as long as I can in a safe manner. Have those conversations with your doctor.
okay.
Yeah.
Okay.
Okay. Well, I'm certainly wishing you the best, and I appreciate you for coming up. because I hope that the information I gave you was helpful, or at least perhaps some confirmation if you've heard it all before. I hope that maybe that kind of lines up a little bit. And then also, I appreciate you because you were bold enough to come to the stage, but I promise you that there's someone who's listening or who will listen, and what you shared is going to help them. So thank you for that.
Okay, and thank you for your help. That
You're
was
very welcome. You're very welcome. I wish you the best.
thanks.
All right. So with that, we've been on here for about an hour. So I'll prepare to go ahead and close out. Again, this has been a live Q&A, a blood pressure and kidney Q&A. I am Dr. Frita. I'm a board certified kidney doctor. Very excited that we have over 1 million subscribers here on this YouTube channel. And one of the reasons I believe that my followers and subscribers hang out with me is because we give evidence-based medical information. I have hundreds and hundreds of videos at this point, not just on kidney disease. I talk about kidneys, how to lower blood pressure naturally, how to lower your cholesterol naturally. I talk about prostate cancer, breast cancer, lung cancer. I talk about Ebola from here to there. I talk about hantavirus. I have short form videos where I cover all of the quick news that pops up in the headlines. I just posted one. Follow me on all social media platforms, please, at Dr.Frita. Because I put different things on different channels. Like right this morning, I talked about the update on the egg recall, because now it's been upgraded to a class 1 recall, which is the most dangerous level. Okay, so check out that video. And I talk about, you name it, I talk about it just about. And again, on Mondays, tomorrow, I'll be back at noon Eastern Standard Time for our live stream where we talk about the latest trending medical headlines and celebrity health news. But when you go and you look at my different playlists right here on the YouTube channel, you'll find that I give evidence-based information in a way that's easy to understand. And here's what's really important. If you're curious about a medical topic, then yes, you can look it up. But also if you're going to your doctor and you're just like, I'm being screened for cervical cancer, you could look up my video on that. Or if you're like, I'm kind of young, but let me see if I have heart disease. I have videos on heart attack symptoms that most women dismiss as stress, on what heart attack warning signs are silent. I have all kinds of heart attack videos. Basically, when you watch my videos, it gives you information to help you to ask questions to your doctor and to protect yourself and to advocate for yourself, and especially in times where Big Brother is watching, and a lot of doctors are in a hurry. They walk in the room, okay, everything looks fine, but if you go, you watch my videos about whatever it is you have questions about, you'll be able to have nice sound questions. So once your doctor walks in the room and they start trying to rush you, you can say, hey, I have these, 2 questions or these 3 questions I want to make sure are addressed, right? Or if they tell you, oh, everything looks fine, kidneys look fine, say, okay, what is my EGFR? Because even if it's CKD stage 2, you want to have the conversation on how to stop the progression. And to know what I'm talking about, go to my kidney playlist or look up Dr. Frita's CKD stages. I explain them in detail. Bottom line, I'm here to provide information for education and also to try to help to close that health disparity gap, and so that you are better equipped to advocate for yourself. Other fun things I do a lot of media medicine, TV medicine. Go to my TV playlist. You'll see where I'm a recurrent medical expert on the Don Lemon Show. I was actually there when Don Lemon streamed the independent autopsy for Nolan Wells. I was there watching it live with Don, and I gave my immediate reaction to the autopsy. So you can check that out. Joy Reid. I was just on Joy Reid on Friday night. Oh gosh, we were talking about RFK Jr., some of his policies and how they are affecting our health. Okay, some of the policies in CDC, FDA. There were a lot of cuts. We're having food recalls out the yin yin yang. He has certain anti-vaccine rhetoric on vaccines. So we talk about that. Talk about MMR vaccine. So we talk about all of that. So check that out. Make sure you follow me, subscribe, and hit the notification bell so you'll be among the first to know when I do lives like this, but also when my new videos come up. And for my one-stop shop, go to drfrita.com. I do offer a telehealth concierge service where even if you don't live in the Atlanta area, I can help you from anywhere in the world, okay? And, we can do a full history and I can give you information. And for my members, like Mrs. Takala, who was up here early, I do have a membership. I have members only live Q&As where it's just my members and we, talk about various topics. And it's a little, more private than this. It's just the members. I have members only videos. I share some behind the scenes action. I was just on the national news show, News Nation. I did 3 segments earlier this week. And for one of them, I kind of propped up my tripod and let the members see me while I was actually filming. We were talking about the jalapeno outbreak. Child, how many outbreaks are there? Anyway, I appreciate all of you for being here. Please make sure you give us a like before you leave, give us share, subscribe, hit the notification bell. And we talked about high blood pressure. Please make sure you get my book, Under Pressure, A Guide to Controlling High Blood Pressure. I do talk about integrative medicine. I talk about traditional medicine. I talk about using food as medicine, and I have it available on Audible. You can go to drfrita.com to get it, or you can go to Audible on Amazon, and it's in my voice. And so that was a labor of love to do that. But I do have the book in Audible, Under Pressure, A Guide to Controlling High Blood Pressure. And give us a 5-star, please. All right. Well, I hope y'all have a wonderful, wonderful rest of your day. I appreciate all of you for being here. I appreciate y'all for keeping the conversation going in the chat. I definitely appreciate those who came up and actually shared their stories here, live and on stage. Hey, Facebook, I see y'all over there. Hey, Facebook, I appreciate y'all. Thank you for being here this morning. And to my replay crew, I see you. Please give us a like when y'all come in here. All right. I appreciate you. I'm Dr. Frita. I want y'all to keep doing everything you can to live your healthiest, happiest lives and have a wonderful rest of your day, rest of your week, heck, rest of your life.